Good afternoon, and welcome to this MIT virtual town hall for the research community. I'm Alfred Ironside. I'm Vice President for Communications, and it's my pleasure today to serve as moderator for this important conversation about the ramp up of campus research. In a moment, I'll hand off to Maria Zuber, Vice President for Research, and Tyler Jacks, who's Director of the Koch Institute and Chair of the Lightning Committee, as it's become known, as well as to an outstanding panel of faculty and staff. Before that, just a quick word on our format. Maria, Tyler, and the Lightning Committee have heard many questions in recent days and have tried to anticipate others. So we're going to start with a brief set of presentations that ideally will answer some of those questions. But we also welcome live questions throughout this session. You'll find a Q&A window at the bottom of your screen, so please feel free to submit questions anytime. You'll also have the opportunity to second the questions that others submit, allowing us to see more easily what topics are rising to the surface. So first, the opening presentations, and then we'll turn to Q&A. So let's get started. With pleasure, I pass the floor to our co-hosts, Maria and Tyler. Maria.
Okay, all right. Thank you, Alfred. Welcome, everybody. So I am sure that you, like myself, are excited about the prospect of returning to campus and to continue the critical and groundbreaking research that is the hallmark of MIT. It's difficult for all of us to be away and constrained in pursuing the work that we love to do and which the world needs. So this afternoon, we hope to answer as many of your questions as possible about how we plan to make this return happen, and in a way that will keep our community and the surrounding community safe. We also want to hear your impressions and concerns so that we can collectively figure out the best way to chart a path forward. Now I'd like to turn over the screen to my co-host, Tyler Jacks, who's the chair of the Research Ramp-Up Lightning Committee and director of the Koch Institute. Tyler is going to introduce the team who's been spending many hours working on our return plan. Thanks to the committee for the remarkable efforts. This committee's been doing 2-a-days in order to take all the input that we're receiving from the community and try to plot a good path forward to get all of our researchers back to campus. So Tyler, take it away.
Well, thanks very much, Maria. I think I will share my screen now, and I'll come back and share another few slides in a moment after Maria makes some additional comments. First of all, it's a pleasure to be with you all, and I look forward to presenting our progress in bringing on-campus research up in a gradual and safe fashion. This has been a concerted effort over the last several weeks, and we're making very good progress. And we look forward to getting your input and answering your questions. If I can share my screen, I'll show you my first slide, which shows the committee. The Ramp-Up Committee, as it's sometimes called the Lightning Committee, was formed by Maria. Initially back in April, on April 9th, she formed this committee to provide guidance to her office to think about how a research ramp-up could look, should look. A group of individuals was gathered and produced a report to her, which was delivered on April 20th. Actually, that's why it's called the Lightning Committee, because we were given a rather short time to produce that document, and we produced one. It was reviewed by senior leaders and DLC heads and deans. We got a lot of feedback and finalized the report, and it was posted on April 27th. And you can see the URL there if you want to refer to that document. I want to thank the members of our committee who represent faculty leaders from across the Institute, as well as many senior staff who worked extremely diligently to put together that report. Shortly thereafter, we were asked to shift our attention to implementation. We shifted the committee slightly, added some additional folks, and over the last 3 weeks or so, we've been working hard to turn those principles, that guidance, into a series of documents that would actually help investigators, faculty members, think about planning the specific ramp-up activities within their lab groups and other research groups. And it's those details that we'll be sharing with you later today. So let me thank my colleagues once again. You see their names. I won't list them all. You'll be hearing from several of them over the course of this next few minutes and into the Q&A, and I've highlighted their names in red here. So I think I'll turn it back now to Maria, who I think has some additional opening comments.
Okay, thanks. So I wanted to talk a little bit about the pilot study that we've started in terms of how to get back. So it seems like we've been planning and planning and planning and writing plans, and it really seemed to me like we have to do an experiment, because you know, until we do an experiment, we don't understand the parts of the plan that don't work. And so as a consequence of that, we didn't know when the governor was going to open up the state to allow research to be done at campus, but we decided we didn't need to wait for that because we could use the population of researchers who have been approved to carry on high priority experiments during the ramp down. So we picked 3 buildings, Building 76, the Building E19, E25 complex, and Building 68. And we chose them because of the fact that they have good access control and you know, we're very suitable in terms of lobby space for people checking in. And so in this initial pilot, we are not letting any more additional researchers back on campus. We're just using the population of people who've been here. And then starting this past Monday, when a researcher comes to campus, they will come into a lobby, take out their ID, swipe their ID, in order to make sure that they are permitted to be working in that building. And when they come to the building, they need to be wearing a face mask. If there's a queue of people, which we weren't really expecting because it's not a large number of people, and they come in at different times, they would need to socially distance. And everybody who comes in enters through a single portal on the first floor of one of those 3 buildings. Okay, so that all has been going pretty smoothly, just a couple of small glitches, but it let us know that it works at that scale, and we've gotten some good ideas about what would be necessary to scale things up. So beginning next week, in those buildings, we're going to be starting a health monitoring app where you come in, before you come in, you have to attest to the fact that you don't have symptoms of COVID and that you haven't, to your knowledge, been exposed to anybody with COVID. And then that will take place, and you will come in, and you will have to have done that in order for your ID to swipe positively that you can get into the building. And so we're learning from that, and it's going to help us a lot in the scale up to move to other campus buildings. So let me just change topics very quickly. There have been a number of questions about human subjects that are being raised. There was, you know, virtually none of this going on during the ramp down. And so we haven't been dealing with it, but we're getting a lot of questions now, and I can address some of those in the chat if people want to raise them. But it raises the point about non-lab work on campus. So we've been focusing mostly on lab work because that's where the overwhelming number of people on campus who do lab work, who do campus work, work. But during the ramp down, we actually had a number of high priority projects in SHAS where people needed to come to campus and get access and do their work. And we evaluated those and assessed those and approved them. And we're also obviously going to be considering them in the ramp up. So there are a lot of questions coming in from social sciences related in terms of how they ramp up. And I think we're going to need some input from some individuals with a somewhat different expertise than those on the Lightning Committee. And so we're beginning to look at that as well. But I just want to say at this point that, that people who don't work in labs, who need to do their work on campus, that's going to be considered, and coming back to campus to do that kind of work is also in play. So, so Alfred, I'll stop right there right now and turn it back to you.
Thanks very much, Maria, and that's just a helpful starting point for the conversation. Let me just turn to Cecilia Stopis right now from MIT Medical. And Cecilia, I think one of the questions that's on people's minds is really about the testing protocols and how we're going to undertake that. So why don't you talk a little bit about where things stand right now on campus and how you imagine the testing piece of this going forward?
Thank you, Alfred. Hopefully you all can see my screen, and good afternoon, everyone. Happy to be here to talk with you all today about what we have been doing at MIT Medical with regards to COVID-19 testing and care. So I thought I'd start off with a couple of points around what we know about the MIT community in the greater Boston area right now, just a couple of high-level items. I think many of you may be aware, but not all, that we do have a CUI's approved surveillance study that's been underway since the 3rd of April. And through that study that we've been conducting, we have tested 1,600 unique people who've had about 2,300 tests over the course of that time period. And this is really geared towards residents who are living in our residence halls and the people who live and work in those same residence halls. And it is an ambulatory and asymptomatic population. And what we know from that so far is that the rate of infection, at least amongst that population on campus, is very, very low, less than 0.25%. The vast majority of our community members that we care for here at MIT Medical who have tested positive have been symptomatic. There have not been very many, I will say that. And they've either been symptomatic or they themselves have had a family member who has tested positive, and so we're at high risk because of that situation. I'll just point to the website where if you are interested in what the latest data that we have available to us at MIT Medical is in terms of members of the MIT community who have reported to us or have tested positive with us for COVID-19, you'll see the link there. Locally, I think, Massachusetts has gone beyond the peak now, which is wonderful, but there are still many, many hospitalized patients, many of whom are still in intensive care units. And there is still many positive tests reported every day. There has been an increase in testing in the Commonwealth over the last, particularly over the last month, and that is, I think, very welcome. I just wanted to point out one item that I think Elazar Edelman keeps bringing up. He works regularly in the hospital setting, and it's that, we all hear about healthcare workers and how vulnerable they are. And once the PPE situations got straightened out at our local hospitals and at others across the country, wherein healthcare workers had the PPE that they needed, and in particular the masks that they needed to be in that high intensity situation, close face-to-face contact with sick patients, their infection rates have been really quite low. So what we need to be thinking about is that the masks matter. And I think, we have alluded to people being masked in our MIT facilities going forward. You've seen that in a number of communications, and there's good reason for that. The other thing I just wanted to touch on is that the current guidance from the Commonwealth encourages people who are returning to Massachusetts from out of state or from international locations is for them to quarantine for 14 days. And MIT Medical does agree with this guidance. We are considering, however, the opportunity to test people upon arrival back into the Commonwealth, and then again, perhaps 7 days later, to see if we could shorten that time frame of quarantine and get people back to work much sooner than the 14 days would allow. Let's see. So in terms of testing itself, I'm going to just talk about this in three categories. So first, return to campus testing. We are requiring that prior to working in the lab, when you all return to campus, that within 2 to 3 days of your anticipated first day, that you will have a test done at MIT Medical. That test is a viral reverse transcriptase PCR, which is collected by swabbing both nostrils for 20 to 30 seconds. I will note that we just started using the nasal swabbing technique a little over a week ago. Prior to that, we were doing the more invasive nasopharyngeal swab, which was quite uncomfortable. This has been much better tolerated by our patients who are coming through to get tested since that time. Those tests are then processed by the Broad Institute, and there's less than 24-hour turnaround time on those. Typically, it's closer to 18 hours, and depending on the time of day, it could even be less than that. And I will note that we do intend to test personnel who've been working on campus throughout this time as well. Surveillance and antibody testing are the next phases of thinking about managing the public health of MIT in a pandemic going forward. And right now we are working with campus and external experts to develop our surveillance testing strategy. It's not fully developed in full transparency. There are many, many different ways we can approach this. But at minimum, we are going to include random sampling of our on-campus community members at various frequencies. And that frequency will be based on our estimation of risk of that person contracting COVID-19 and transmitting COVID-19 to others around them in the community and what those risks look like. So there may be a different frequency of sampling a population who, for example, lives in a residence hall compared to a population who, is, working with animals. There's pros and cons to all of these strategies, and there's many factors that need to be weighed. A few of them are things like accuracy, how acceptable the testing is to the people being tested, convenience, and cost. And the last thing I'll say in this space is I get numerous emails and questions every day around, is antibody testing available at MIT Medical? People want to know if we have it, and some are even demanding to have antibody testing. And at this time, we are not providing antibody testing for members of the MIT community in any capacity. There's a very high false positive rate with those tests, and as you can imagine, that has high consequences if the person who thinks that they have antibodies to COVID-19 in fact does not, and maybe takes additional liberties with their social distancing and whatnot. But it will be a tool that we will consider using in the future as it becomes more clinically useful for the population. And then just briefly, symptomatic testing. All along, MIT Medical has been testing people with symptoms. We have, in that measure, followed the CDC and state guidance on that. Right now we are fortunate to have an abundant supply of test supplies here, and we have ample access to the Broad Institute to run those tests. So we really test anyone who has any kind of a symptom. There's very few, no criteria really, other than having a symptom, and you would come through the symptomatic testing pathway, which is handled in a different way than the surveillance testing has been handled. So you see a different team to be swabbed, and it's done really more in the standard fashion of a more normal kind of a medical visit. And the key thing for that is that if you are symptomatic, you must quarantine while awaiting your results. So that's one thing there. We've had a number of questions about what happens if you had a positive test. And, right off the bat, if you have a positive test, you're going to be required to isolate at home for up to 14 days. It could be longer if you are still symptomatic. There's various pathways for releasing people back to work and school after a positive test. You're going to be asked to provide our occupational medicine and student health team with a list of the people you've been in close contact with in the 48 to 72 hours with prior to a positive test so that we can complete contact tracing and the people around you. You may also be contacted by your local public health department, depending on where you live, or the state public health department. And we will check in with you periodically during that time of isolation to make sure you're doing okay and to advise you about when you can go back to work. And then just finally, I want to mention contact tracing. People who have been in close contact with somebody who tests positive, they will be contacted by one of our staff by phone, and we will obtain a history of the exposure. Some of these contacts that are reported to us are very substantial contacts with a close contact in the CDC terminology. Others are much more transient and low risk. But we will do an assessment of the risk and then advise whether testing would be required for the people who are involved. Certainly we will provide testing for people who are close contacts. They too will need to quarantine while awaiting results, and they might need to quarantine for even longer than that, depending on the situation specifically. If there are indications of a cluster in a particular area, so that's where we have several people who have tested positive in a particular lab or work unit, we will advise on what public health measures need to happen next. You know, does there need to be a deep cleaning of the area? Should everyone stay home for a period of time? Those are the kinds of interventions we can take when there is the presence of a cluster. And every situation is handled individually, so it's not one size fits all. And finally, we are going to be implementing some sort of contact tracing technology solution. We are evaluating those opportunities and trying to figure out what would make the most sense for the MIT community. And I think with that, Alfred, I'll hand it back to you.
Thanks, Cecilia. I'm seeing some questions coming in on the medical questions. We'll get to those later. I just want to turn to Tyler now and get to the meat of the matter, which is what we're thinking of in terms of how we do this ramp up, given what we've heard from Cecilia. So Tyler, over to you and to Jim.
Thanks very much, Alfred. So I'm going to begin this part of the presentation and then hand it to my colleague, Jim DiCarlo, who will go through some additional details. If I can frame what our plan looks like, this slide tries to do that. Importantly, while we're all very anxious to increase the level of activity of on-campus research, we also want to do it in a very measured way, in a way that prioritizes the safety and the security of our community. And so we've thought about that in many different ways. And I would say that everybody has a role and a responsibility in trying to do this right. We've prioritized, for example, the PI's ability to figure out for themselves what is a sensible way to ramp up their own research activities. So the PIs will be developing their own research ramp-up plans, and Jim will review how that will happen. DLC heads, of course, will have responsibilities to make sure that those plans are properly constructed and properly implemented. In addition, many of the researchers use common facilities on campus, core facilities, animal facilities, and the like, and we have to be very careful not to overburden those facilities, which also have to carry out their work with the same sort of density and space considerations that we will all be working under. And so we have to be very careful to manage the flow and demand on those facilities. So DLCs will be working together to evaluate that. The MIT administration likewise has responsibilities to make sure that, for example, central services like custodial services are not overburdened, and that the conditions under which research at MIT is carried out is thoughtfully considered and explained. So everybody has a role, everybody has a responsibility. Our committee has developed specific guidelines, as I've mentioned, and you can review them. I've picked out some particular ones here. With respect to PIs and frankly research personnel, there are several, but I'll highlight three here. Firstly, the return to campus is voluntary. We know that there are many individuals who, for one reason or another, either cannot or do not want to return to campus at this time. And that has to be respected. Indeed, to come back to campus, a member of the personnel has to affirm, using an online system, that they understand that this is voluntary and that they agree to certain conditions. And Cecilia's mentioned some of those. Undergo a test upon return to campus, for example. Provide information if you were to test positive so that contact tracing can take place. Fill out a daily health attestation. These are all things that individuals will have to acknowledge online, and that information will then be available to enable them to access research buildings. We're maintaining the policy that all work that can be done remotely will be done remotely. And this is important to reduce as much as possible the on-campus density, which is important to maintain as best we can a safe work environment. We know that we'll discuss the fact that the research labs and other spaces will have to operate differently than before, both with respect to density considerations and occupancy considerations. And PIs will have the responsibility of developing plans along those lines, and Jim will talk to you about that. DLCs have responsibilities too. They have to oversee the construction and execution of those plans. They have to make sure that the core facilities and other facilities are not overburdened. And they also have to establish plans within their common spaces to make sure that they are being managed and used safely. And here I'm listing lunchrooms and bathrooms and elevators. And you'll hear from Daniela Rouse, who's on our committee, is available to answer questions about that. She has within our committee overseen this work group that has developed this set of policies, and those will be available shortly to the DLCs and to others. And then, of course, MIT has responsibilities. Kristen will discuss later access and how buildings will be accessed. Maria's mentioned this in her discussion of the pilot. This is an important consideration so that we know who's coming on campus and that they're supposed to be on campus and that they've done the things that are necessary in order to be on campus. One of those that we've mentioned a couple of times is these daily health attestations. A person must fill out online or on an app on their phone that they lack COVID-19 symptoms and thus are at least asymptomatic. This is an important step in the process. You've just heard from Cecilia that we have protocols for testing and contact tracing and the consequences of a positive test. We believe that it's important that all of the returning personnel undergo an EHS online training that is specific to work practices in the COVID-19 era. And that will be available next week for people to sign on to and demonstrate that they have taken that. And finally, on many people's minds is the PPE policy. And here, Elazar Edelman has led our group in working through a policy statement, which will be posted, I believe, later today. And Elazar is here and available to answer questions related to that. So finally, with respect to sort of the broader view, we're currently in the pilot stage, as Maria said. We anticipate in the short term moving into the research ramp up phase 1. This will be limited in terms of the capacity of an individual PI's research activities to 25% of full capacity. Jim will explain exactly what we mean by that, but the view was, and here we're sort of echoing the views from MIT, that it's important to start slowly, to make sure that we understand how to do research under these new conditions, to do it safely and effectively. And then as we develop best practices in that realm, we'll be comfortable to move forward into a second phase where capacity will increase here to up to 50%. And then in the longer term, we'll return to an even greater level of capacity. I think this phased approach is highly sensible and sort of mirrors exactly what you're seeing from the state of Massachusetts in terms of how businesses are being advised to ramp up. The process is underway. We have released guidance earlier this week to PIs and DLCs to help build their plans. And today we released a spreadsheet, which is relevant to the second of the planning exercises that Jim will review for you shortly. So progress has been made. Work is now being done in terms of building plans and getting us ready for phase 1 of the ramp up. And there'll be more guidance shortly to come. And now I'd like to turn it over to Jim, who'll take you through more elements of this phase that we're in today.
Okay, thank you, Tyler. It's a privilege to serve on this committee and to serve MIT in this way. I'm going to share with you a few more details to expand on some of what Tyler outlined there. So as mentioned, we're talking about moving into phase 1 relative to where we are today, and this slide that Tyler showed as well. And the overview that I want to keep, especially this is to PIs to keep in mind, is that we're trying to ramp up research. Of course, that's our larger goal, and we're trying to do that within some guardrails. And one is to, we call, let's say, A is COVID-safe operation of MIT research space overall. But also, we're working under a target of trying to keep on-campus total research personnel below a 25% occupancy target on average. So that's an occupancy target, not a personnel number target. And we're trying to not overwhelm the safe capacity of any research core facility as well. So those are two big guardrails from MIT that the committee has been working with. And the solution that the committee has come up with that I'm happy to share is that the goal is to really, as Tyler emphasized, to empower each PI group and research group to determine which on-campus research they believe is most essential to get done, to leave those decisions to the PIs and the research group, but to give guidance and hopefully what we'll think of as some simple tools for each PI to do that in a flexible way within the overall MIT guardrails that are listed above. Now, to be clear, some assumptions are built into this that I hope the PIs will take to heart is that each of us as PIs will work hard to respect the guardrails, and each will work compassionately to lead their research groups in this effort. And that DLCs and MIT will provide oversight and infrastructure support, as Tyler emphasized. So this basically translates down from those MIT goals to goals at the level of individual PIs. And so if you're a PI listening to this, exercise A that we'll describe in a minute is to plan the operation of your research space that you oversee to make it safe. And we've given some guidance on how to do that, and I'll show you sort of an overview of that in a minute. And your exercise B is to plan your on-campus research activity, that is your total person hours per week, to be less than 25% of your normal capacity, and to work with your personnel on executing that. And also to indicate your core research needs. So we have two planning exercises that align to these guardrails, exercise A and exercise B. They have two relatively simple deliverables to move us along, and I'm going to take you through those now. So exercise A, again, is focused on planning the operation of your research space that you oversee. We provided you in the guidance a number of steps, step by step, to follow. I'm not going to take you through exactly every one of those steps, but the big picture is really actually not that complicated. It's really all about planning safe density and distance during static work. And by density, we're trying to achieve a target of less than 1 person per 160 square feet in any research space, and at least 6 feet between persons working in static situations. And so you can start, if you think about your own research space, by thinking about any rooms that you have, all of the rooms you have, take each of them. The density target basically gives you an upper bound on the maximum number of people you might have in there in a static situation. And then, of course, that's an upper bound, and the goal would be to stay below that as far as possible for an actual occupancy per space. And what this translates to is looking at each of your rooms, and you will be each delivered floor plans by your DLCs, and to plan, given the layout of your room, and this happens to be just example biology labs, and we know each research space will be different. Plan the layout starting with the number of people that you might have in there. Again, those are maximums, ideally staying below that, in both the density and also the distance, greater than 6 feet. Again, ideally, the more the better. And of course, we're allowing for that there may need to be occasional uses of less than 10-minute non-static situations that you can also indicate. But what we're showing here is a sort of schematic of what we're hoping you'll send your DLCs as you plan your own space, and just deliver a marked up plan like this one to your DLC for review along with the narrative. Here's just, by the way, examples of things that you would not want to do: put people statically close together, less than 6 feet, or too many people in a room exceeding that 160 square foot rule. And we've provided these examples in the guidance. You don't have to find them in these slides here. And just the bottom line is you're going to just submit a floor plan and a narrative by soon, May 26th, which is this coming Tuesday. We think this will be a relatively fast exercise for you to carry out, and your DLCs will give you help in doing this. So that's part A. Part B is to plan about how you're going to do your on-campus research activity, your personnel hours, trying to stay below 25%. Again, we've given you a checklist to work through, to think this through in great detail that we provided to you in the guidance. But again, the overall picture is really quite simple. And the idea is you're going to plan your available personnel, the on-campus hours granted to each within an overall capacity budget for your individual research group. So when I say plan your personnel, you'll have to think about who's willing, able to do so, and not virtualizable to do so. And in terms of your overall capacity budget, you're going to want to think about your budget is determined like this: the number of permissible personnel that you have in your group, multiplied by a simple number, 50 hours per week. That's what we refer to as your 100% activity capacity, on-campus capacity. And your PI budget for the first phase 1 is just 25% of that. So simply, if you had 10 people, 500 hours, that's 500 hours. So it's 125 hours for phase 1. I stress this is for PI research groups. Core research groups will be working under a different constraint here. But the upshot is we give you a lot of flexibility. So the idea, each PI can assign that budgeted hours per week in whatever way is best for their research activities and their personnel, distributed among personnel in whatever way is best. So again, I stress this is a capacity on hours per week, not a capacity limit on exact number of people that you, or fraction of people that you grant access to in your group. And to help you facilitate all of this, which again, if it's quite simple, though, we've given you a spreadsheet tool that, as Tyler mentioned, is released today, that will allow you to work through this in entering this information, and we'll even compute some of it for you. And this sheet will also allow you to indicate the buildings that need to be accessed, the cores that you need, and approximate weekly schedules. And I would add that this is important because this information not only grants your folks access, but it also gives MIT broadly and the DLC's data on a kind of likely number of people coming to each access point, and helps us do planning ahead and making sure that we don't have bottlenecks in accesses and so forth. And again, the deadline on this one is a little later because this is a little more work, and we think this by about June 1st or so. And if I could zoom in on the sheet, I'm not going to take you through the detail except for the one line that you first will fill in, which is the responsible PI name that you see here on the left, where I've used my own name. And again, I want to stress that for this plan to work, each PI is to take responsibility not only for doing these exercises A and B, but for messaging to the people in your lab that this is important to their safety, and that they follow the plans, and that they follow the hours that they're assigned in terms of total number of hours to keep us at the targets that we've set here. And the way I like to say that is, let's all work well together before we pick up the pace. So let's do a good job together, and then we can move more quickly onto later phases as we execute this well together as PIs and research groups. And with that, I'll turn it back to Alfred.
Yeah, thanks, Jim. And I'm going to turn to Kristen next. We're running a little over, but maybe we can run past the 2 o'clock hour if we need to. But before I do, just a question that's been coming in regarding the restrictions on the total number of people in a lab in any given moment, as opposed to what's my budget for people in a given week or period of time generally. How are we going to control the number of people in a lab at a given time? Yeah, and that's right back to you, Jim.
Oh, I can take that one. So notice there's really 2 controls on it. The first is if your lab only has a certain amount of space, then the density limits that to some degree. And the second is overall MIT, given the hours, the way we're assigning hours, that will keep the average occupancy at the target of 25%. So there's essentially two guardrails in there. One of them's pretty strong, which is within the space. And the second more is an aggregate guardrail on the fraction of capacity.
Okay. Thanks for that. Yeah, that's helpful. Kristen, I'm going to turn to you now because you've been really doing all the hard work on building access and space planning. And so let's hear what your overview is. And then there's some questions related to that as well. So I might stick with you as soon as we enter the Q&A. Go right ahead, Kristen.
Sure. Thank you very much. And I'll be brief so that we can make sure we get to your questions. Thank you, Alfred. So it's certainly not just me. There's been a lot of folks working on this to listen to the Lightning Committee and much input from the rest of the community. So the way that, as Maria mentioned, we thought would be sensible to do this was to do a pilot, to do an experiment about how we would think about coming to campus as we do this ramp up. And so the experiment is shown here. We call this the Building Access Pilot. And this is in effect now. We've been doing this as of officially this week on the current population of researchers who are approved to come into campus. So this is underway. The 3 buildings or sectors that are shown here. Building 76, which is on Main Street, Kendall's in this direction, Building 68, and then this sector, which is several interconnected buildings, and we all know that that's common at MIT. So just to show you that it is an experiment, initially we thought when we laid out and just looked at the map, well, let's make that entrance here. Just in putting these plans together, walking through the spaces and the teams of people getting this ready before we delivered it, we've moved that access point. But it just gives you the feel to say that there's going to be a single door that you would come through. But we've done a lot of practice on this. We're adapting and learning as we go. We're taking feedback from this current researcher and staff population who are using these spaces to learn how to do this better. And we'll continue to do that throughout the pilot. The other thing you'll notice at the access pilots and throughout the campus as we ramp up is an increasing amount of signage that explains the practices that we are all adopting together. So if you go in these buildings, you'll now see signage that has Tim the Beaver showing the face covering and the expectations around that. And you'll also see everybody wearing their MIT IDs that, as Maria said, you'll swipe in when you come in. So while this is a work in progress, we really benefited from the community pitching in to not just start it, but participate in it. And we'll continue to improve upon that as we increase the research population and the staff that support them on campus. Thanks, Alfred. Back to you.
Yeah, thanks, Kristen. And I'm going to start us into the Q&A now. And just remind folks who may have joined late that you can submit questions at the bottom of your screen, and you can also vote on the questions submitted by others. But Kristen, let me stick with you just for a minute, because we're getting questions about, it's one thing for PIs and departments to plan the effective use of space. How are we going to ensure that things are being done correctly? There are not too many people, or people aren't staying too long, or people aren't pressured to be in the labs longer than they are meant to be. How do we enforce the restrictions or the planning?
I think many people on the call are in a position to answer that. As a PI, I'll give my sense of the own answer, having worked on aspects of the operationalization. So first, it is, as Tyler mentioned, everyone's responsibility, the PI's responsibility to lead their lab and say, this is what we're going to do here, folks. And it's also the responsibility of the department lab and center leads to give that sense that there will be an awareness of everyone following common practice and a positive peer pressure to make sure that's what we're all doing. In terms of potential coercion to work longer, stay past your shift, try and prioritize a given experiment over the whole MIT community's buy-in to this approach. There is a hotline in place now, and there will continue to be a hotline and multiple ways that people can provide feedback if they're not comfortable with that practice. Maria has discussed those before. She could expand on them now, but that's a key part of not just the pilot, but the way the campus is operating right now.
Yeah, so that's so at this point we're just swiping people in and we're not swiping people out. And so one of the options of the committee is talking about whether people would get swiped out also, so that we, have some record of the number of people who are in the building. And as I was quoted in the Boston Globe this morning as saying, we don't want to be policemen here at MIT. But the number one question that I'm certainly getting, and I'm sure that others here are getting as well, is MIT doing enough to keep me safe? And so we do feel like there needs to be some kind of enforcement. And I agree totally with Kristen, is that we all have to be part of this enforcement mechanism.
So thank you, both of you. And anyone else on the panel, if you want to jump in at any time, just please raise your hand and I'll get to you. But let's just stick with this theme for a moment about the space use. I have a question about the 25% of capacity, of normal capacity, seeming overly restrictive. In other words, is there a way to spread out the working day over 16 or even 24 hours so that more people could use the space just spread out over time, and whether that's something that's been considered or not?
I can take that unless, Tyler, you'd like to.
You go right ahead, Kristen. I'll add anything if I feel I need to.
Okay, thanks. So we all know research is not a 9-to-5 job. So the pilot is running with 24/7 access expectation, meaning that check-in desk and that access portal is staffed 24 hours a day, 7 days a week. And the intent was exactly as you said, to experiment in spacing out the working hours. So 25% of the capacity at any instant in time, but allowing that to be spread over more days of the week, more hours of the day. That's not the same as saying we should all work 24/7, and it's definitely not the same as thinking that the core facilities or other operations that are central to MIT would be operating 24/7. Some do, and so we're trying to make clear that research can go on 24/7. The full building services related to custodial will feel more like 24/6. But we will adapt as needed for that posture and that cadence.
I guess I would just add that, I think there's a couple of considerations here. Firstly, the space constraint, I'll call it, the space considerations for some labs at least will cause them to need to use alternate day shifts, multiple shifts per day, just to be able to meet the space requirements. So it's not just, it will not be the case that everybody's there working 25% of their time. That can't happen because of the space considerations. I don't know that it'll be evenly distributed over a 24-hour period, but I predict that many hours of the day will be needed for many laboratories. And the other thing to say is that, you know, as I emphasized earlier, this is an early step. And I think Jim's phrase of learning to walk together well before we pick up the pace is a very good one. This is going to be new to us, and we have to get used to it. If all goes extremely well, that first constraint related to capacity can be relaxed, and we can move to a different phase. Recall there is an anticipated phase 2. And so we look forward to that transition. And then I think the third thing I would say is remember that we're talking about the work that you have to do on campus. If there's work you can do at home, you should be doing it at home. Data entry, data analysis, writing manuscripts, all of that, group meetings, other meetings, all of that will take place virtually. And so the number of hours that you're in the laboratory would naturally be fewer than if we were under normal circumstances.
Thank you, Tyler. Cecilia, in a moment, I'm going to come to you with some questions about testing, and Elazar as well on masks and things like that. But let me just stick right now with the conversation we're in. And Maria and Tyler, I think this is best for you. In terms of the plans are being, folks are being asked to work on their plans now and submitting next Tuesday. How much notice will labs and lab staff get before they are allowed to resume research?
Okay, so I'll start with that, Tyler, and then you can take on. So people should put their plans together, and then the people in their lab should fill out the acknowledgement forms about whether they feel they want to and they feel comfortable coming back. And what will emerge from that is a list of people who will be back in the lab. Those people will need to be tested. Our hope is that they can be tested rapidly so that they will be available to go back in the lab. But then these plans will go to the department lab and center heads who need to review them. And so I suppose it's a question of how long it takes these reviews to take place. But when that happens, we hope to be ready to get people back in the lab. Tyler, do you want to add anything?
Yeah, I would probably describe the sequencing slightly differently, Maria, as I see it. I think PIs will be having discussions with their lab members, their personnel, talk about their willingness to come back, their ability to come back. That will trigger the online acknowledgement form. When that form is signed, individuals will get information about undergoing the viral PCR test. I would suggest they do that as soon as possible thereafter, and take the online training, be ready to return. The plans are due on June 1st. They will be reviewed. They might have to be adjusted, but let's hope that that process can be quite quick. And at that point, in the first week of June, we would be ready to say, we're ready to go. We might be able to say to certain labs, you know, in the days following June 1st that we're ready to go. And then if the other conditions have been met, they've gotten their tests, they've signed the form, they've taken the online training, they could begin work the next day.
Yeah, but the fact of the matter is that it's a phased, you know, as people get approved and, you know, take care of all the things that are required for them to come back. Once that happens, they can come back. So.
All right, then let's turn to some of the medical questions that we're getting, Cecilia, starting with the testing. And the question is, will all staff need to be tested in order to return to campus? And if so, on what frequency of a basis, and do we have the capacity for that? How are we thinking about all those things?
So we are taking a very egalitarian approach to this, which is if we're going to test one subpopulation of campus, we're going to test all the subpopulations of campus. It doesn't, you know, for example, if we had intended, like many universities, to test all students on return, which we do, we are not going to then mix those students who have tested with people who are unknown and untested. So from a practical standpoint, if you sort of are going to have a mandatory testing or required testing protocol for some population, from our perspective, we felt that it would be important to apply that equally across the population. And that would be, I think, more acceptable to the MIT community. The other part of the question, which was what, Alfred?
It was just removed from my list, but yeah, go ahead.
I don't remember.
Okay. That's all right. Let me just go to the next part. It had to do with masks, and are there circumstances under which masks can be removed while in labs? And in particular, if people are eating lunch, or can they remove their masks if they go, do they have to go outdoors to eat and that sort of thing?
So I can take that, I think, or at least a first crack at it. So, you obviously you cannot eat lunch or drink while you are wearing a mask. We would expect that while people are actively working in their lab, they would continue to wear their mask at all times. And that things like lunch would be, of course, conducted outside of the lab area. We do think that there's going to be the opportunity to use offices that are not currently used by folks who are able to continue working remotely to provide private lunch spaces for people to have lunch. And then, of course, you certainly could have your lunch outside. But yes, when you are in the presence of other people, you should be wearing your mask, or if you're in any common area of any of the facilities.
Elazar, I'd like to ask you to jump in on that as well, if you wouldn't mind.
So somebody else was going to make a comment.
I was going to make a comment and say that we are asking the DLCs to create lunch and eating areas. We are thinking that in the first phase, if someone is on campus for less than 4 hours, they will not be eating. So only people who are on campus longer than 4 hours will be eating. And we are asking people to minimize the amount of time spent having lunch. We are also asking for no shared food or beverages. So it will be bring your own lunch, bring your own coffee, bring your own water.
And that was Daniela Russ. Thank you, Daniela. Elazar, anything to add?
Yes, so what I would add would be the following. We know that the bulk of the transmission is through aerosolization, and increasingly the evidence suggests that surfaces less so. Masks are therefore vitally important, but by the same token, and therefore when you're in a laboratory with other people, you should be wearing a mask. The only people who are exempt from wearing masks are those for whom in public places masks present a problem with breathing, they have some disability, and those people in general should probably not be on campus. So as you heard, when consuming food or drink, or when it poses a hazard to other people. So I don't have much more to add other than to emphasize that, recall, this is an aerosolized disease spread virus.
And so in that regard, I'm coming to Kristen and to Joe Higgins here. There's some questions around the common spaces on campus, hallways and other lobbies and entranceways and things where people have to pass through in order to reach labs. And you can imagine some of those underground hallways not feeling very ventilated. What's the situation there? How safe are we?
Thanks, Alfred. That's a very reasonable question. Joe could certainly weigh in on what we know about the building systems. And of course, we know a lot, and we've learned more to take account of those concerns. But if you take the infinite corridor as an example, that's a large volume hallway, meaning there's a lot of air volume in it. It doesn't feel confined. But at the same time, there's research going on in that building where the hallway is used for transit. And if you see people gathering, even though they themselves are 6 feet apart with their face coverings on, and you need to walk past them, it's anxiety inducing, and it will feel that way for a while at first. So the way we think about the hallways is the hallways are means of transport to get from A to B for the foreseeable future, meaning we're not going to be aggregating and chit-chatting in the hallways, because they are sufficiently narrow that it makes it harder for other people to make it themselves feel they're maintaining physical distance from you. And that's just, I think, adjusting to living together again on the campus. In terms of the common areas, we look at them specifically. They're all different in terms of their air volume and so forth. We'll maintain the similar considerations that have been given for the laboratory as well as the learning spaces in terms of people density. And we'll post that where it's helpful on the elevators, on common spaces that can be used of a certain type, and on common spaces that cannot be used under the current guidance. So we'll use signage to communicate that more easily to folks. But we are mindful of that concern of being in the same space or exchanging the same air volume together.
Okay, we have many, many questions to get to, so I'm going to see if we can get through some of these quite quickly. Just, Kristen, while we're with you, or Joe, can you speak to the bathrooms and the elevators and the cleanliness and so forth?
We can. Joe, would you like to take that one?
Sure. So we are conducting frequent disinfecting in all the heavy traffic areas, and we're going to be ramping up our custodial team over the next several weeks to support the population coming back, to increase that frequency in those high traffic areas. But we do have protocols as part of the checklist, as part of the compliance for Massachusetts to be able to ramp up labs that we comply with logging and tracking of disinfecting the various spaces.
And is it correct that staff will be receiving masks upon arrival at their buildings? They don't have to bring their own?
Yes, we have plenty of masks at the building checkpoints, and in Lobby 7, we have 250,000 face coverings in our warehouse that we are distributing to the DLCs and the labs, and we're working on a distribution plan for that in the next couple of weeks.
Great. Here's a question I think maybe for Kristen. Again, I don't know that we have a direct answer for this, but there's concern about how people get to campus if they're living off campus, and there's this concern about obvious concern around using public transit. What is our guidance at this moment on that? Maybe Kristen or Cecilia or Maria?
Yeah, I'll say we don't, so I'm not aware that we have specific guidance, but we are learning what the Commonwealth is planning for how they will operate the public transportation. They will seek to manage the times and the density of the public transportation options, and they've encouraged all of us, and of course MIT is following this guidance, to stagger your arrival hours to help keep the load and the demand on the public transportation as low as possible. So I think, that's a personal decision of what you feel comfortable with. That's why MIT is giving you the opportunity to opt into coming back to campus. But we are tracking that guidance closely. If the community feels it's helpful that we add that information that we don't control, but we put it into the information available to the community, we can certainly package that up and share it.
Yeah, and I'll just add that we're extending keeping the parking garages open to the MIT community until September 1st. So that option will exist at least through the summer. As we get more and more people back on campus, there are going to be constraints on that, but through the summer, that option will be available.
I would say that the governor on Monday did talk about if you have another means of transportation, you should use it so that people who have only public transportation as an option have the safest available public transportation possible with the least amount of density. So,
if I could just amplify Maria's answer, it's not just that the parking garages will be available, they're free.
Mm-hmm.
So here's a question that's coming in a couple of times. I want to get to it, which is, for folks who are joining us from out of state right now, they're concerned about what measures they have to go through. They understand that there's still a 14-day quarantine for people coming from out of Massachusetts. How do they get into the mix here in a reasonable way? What are our expectations of folks coming from out of state in terms of the testing protocols and the whole plan?
So I'll take part of that, which is, I think there's two flavors of out of state. So there's out of state, I live in Rhode Island and I commute to MIT. Or in my case, I live in New Hampshire and I commute to MIT. That is one flavor. And then the other flavor is I live in, the far side of Connecticut and I'm moving back to Cambridge to return to my work there. So in any case, people coming back to campus will have a return to campus test that will come along with that. And otherwise, once we get that, so that would be the first step. And then it's, quarantine for 14 days if you are moving back into the Commonwealth. And or depending on how we are able to proceed with a repeat test, it's around 7-day time frame. We haven't made that final determination yet. We're still looking at the data around that. We may be able to get people off of quarantine earlier, those moving back into the Commonwealth.
Okay. Anything else anyone wants to add on that? Okay. Here's a question that's very broad in nature, which is how our plans compare to other big research universities. The sense coming through in some of the questions is that MIT is more restrictive or more conservative in this regard, and we're already an expensive university at which to perform research. Are we putting our faculty at a disadvantage, especially as junior faculty? Maybe that's for you, Maria.
Well, I mean, I'll start with that. So we confer regularly with our peer institutions in the Ivy Plus, in the Boston area. And what MIT is doing is very consistent with what our peers are doing. So we stay in close contact and we exchange plans, and we're all very much in line. So MIT, in my view, is not more restrictive than our peers.
Any other comments on that? Okay. Cecilia, coming back to you, let's say there's a second wave or a resurgence of infection rates despite our best efforts. How are we thinking about depopulating labs or going so far as to shut down facilities again? Are we thinking about that?
We are thinking about that, and I would say it's very clear that the Commonwealth is thinking about that. The governor was very clear on Monday that each stepwise going from stage 0 to stage 1 to 2 and so on. At every decision point, there is a chance that we could go backwards, and I would say we are thinking about it the same way for MIT. We will be closely monitoring the a set of metrics that we are working on, sort of finalizing the final group of those, of what those will be. But at the end of the day, if things are not trending in the right direction, yes, we would proceed backward down the sequence.
Okay. Alfred, if I could just add one thing there, because of the possibility that things could get worse and floors or buildings or all of MIT would have to be scaled all the way back again. Part of our guidance to PIs as they ramp up is to bear that in mind. And there might be certain experiments that they will prioritize or deprioritize due to that possibility. So I think it is an important consideration.
All right. Thank you, Tyler. The next couple of questions here have to do with how we'll manage both the space considerations where there are animal research parts of the labs. In other words, do the restrictions on space apply even to animal labs where they may be smaller? And then do we have a plan for ramping up human subjects research? Sorry, I flubbed that first question, but I hope you get the drift of it.
Yeah, I'm happy to take the first one on the animal care facilities. So those who are asking that question are aware that those animal care facilities are unique and different in terms of what would happen in them and their location and their size. So I think what's helpful to know here is that we're in very close communication with Jim Fox, who's the director of the Division of Comparative Medicine, and we are discussing that in detail. So if you are a user of the animal facilities, whether it's animal care or animal use, we'll make sure that that guidance is clear to you as a subset of that community. We're following guidance that's consistent, but also taking the animal welfare and the nature of those activities into account. Good question.
So Jim is on. So Jim, do you have anything to add?
No, I think Kristen did a beautiful job describing that, but we have a very stringent entry criteria based on the 25% occupancy, and we're using a software program called SuperSAS, which will allow us to critically monitor the number of individuals in a given animal space. So we are following policy that's been described by Tyler that's particularly applicable to our space. But I think we're cognizant of all those requirements.
Okay, and Alfred, I'll deal with the human subjects question. So, Lee Fern and the COEUS committee has been developing a plan for the ramp up of human subjects research, and so they are envisioning a two-step process. First of all, PIs would need to complete a brief application to restart their human subjects research. It's not meant to be burdensome, and they're developing a web-based process that's going to operationalize it. So the beginning would focus on human subject research that would occur on campus. And subjects would need to be screened prior to coming on campus for COVID symptoms or being in the presence of people who have tested positive to COVID. And so, so the thought is that initially at the beginning, only healthy adults would be studied on campus. After that, they would add vulnerable subjects such as children or those who might have say a cognitive impairment. And the latter stage would be those with the highest risk. So, so people who are more elderly or who have a chronic disease that's problematic. And so, and then off-campus human subjects research would probably occur later, but those requests would be dealt with on a case-by-case basis because they would need to look at what the public health situation is in the particular area where the work is being done. So, so the committee is working on this. As soon as we have the official guidance, it will be posted, but that's a summary of the way that they're thinking.
Thanks, Maria. And that was also Jim Fox who helped answer that question on animal labs. Let me go to back to the question of testing. And this is really an equity question regarding whether or not MIT's use of tests for students, for researchers, is somehow unfair. In other words, we're using tests that need to be used elsewhere in the broader community around Boston or Massachusetts. Are we haves and others are have-nots when it comes to testing, and how are we thinking about that?
So I would say that, yes, we certainly are a have when it comes to testing, but the testing capability that we have, we actually cannot, because of the nature of our clinic license here at MIT Medical, we cannot actually broadly test the greater community. So we can only use our tests that we have available to us for people who are part of the MIT community. What I will say is that the testing capacity within Massachusetts has grown by leaps and bounds over the course of the last month. And there is, both here and across the country, there is an underutilization of tests because many healthcare providers are continuing to very strictly follow the guidance that has been provided in terms of what are the criteria for testing. And part of that is unfortunately around how those tests get paid for. So screening and surveillance tests are not covered by insurance. And for that reason, many organizations are not testing people in a screening and surveillance fashion. They're only testing people with symptoms, and those are covered tests. So part of it is about how healthcare is paid for in America.
Right. All right. Thank you, Cecilia. Look, we've gone several minutes over our allotted time. I'm just going to ask us to stay with it for a couple more minutes because we're at nearly 200 questions. And thanks to the upvoting, we've been able to cluster them, but I'd love to get to a couple more if everyone's okay with that. This is a question about whether or not there is any flexibility in the standards for ramp-up plans. In other words, one department may have a small amount of space and a larger number of researchers that typically use it, whereas other labs have a lot fewer people in a much larger space. Is there some variability or some flexibility that will be tolerated or worked through in these cases?
Well, I'll take a crack at that, and I think Kristen might want to weigh in also. I think the way the guidance was given to our committee and the way we executed that, we felt that it was important to apply the same rules to everyone. So PIs are treated the same, DLCs are treated the same, and as such, building to building adjustments would be challenging. So I don't think we've anticipated allowing that sort of adjustment. Kristen, do you want to add anything there?
Yeah, I can just add, I certainly understand the desire to do that. I think it's difficult for most of us to appreciate until you play it out all the ripple effects that your decisions on access have with the rest of the MIT community. So over time, perhaps there is that flexibility, but I can tell you from the weeks that we have been doing this, we learn about the ripple effects of access decisions and volume and so forth. So that won't be in the short term, simply because our primary goal is to get MIT's operations back up and running as safely and effectively as possible, right? And so where we can take the risk and uncertainty out, we want to do that, and also be as equitable as possible. So I appreciate that. I feel that way for my own lab. I get it, but I don't think that's how we can start moving forward as an MIT community.
Thank you all. I'm going to try and get through the last couple of questions here. This one has to do with visiting students. The research ramp-up documents say visiting students should not be included when calculating lab capacity. So will they have access to labs?
Yeah, I'll take that one, Alfred. So, so there had been a hold put on visiting students, and that hold will be extended. So we've discussed this. We recognize the important role that visiting students play in the operation of some labs. But we have a lot of people from the MIT community who are dying to get back to campus and start their work. And so it's difficult to prioritize the return of visiting students to campus before we bring back the members of our own community. So, so I believe we've extended the hold on visiting students, I believe, through the summer, and we will look at that and see how it happens. As I said, we very much recognize the importance of these folks, but we really want to get our own community members back.
Thank you, Maria. Here's a question that I think applies not only to the research operation, but more broadly, and it may be a little unfair to pose it without others from the Institute here to answer it, but I will anyway, because it's been asked a number of times, having to do with daycares and camps and schools closed, and staff who really have a challenge coming into a lab when they have kids at home. Are we thinking about how we can help the research staff manage through that?
Yeah, so unfortunately, we really would have benefited from having Ramona here, but she's on another parallel call where a significant HR issue is taking place. But we, I would say that that after lab safety, childcare and parking are the two most frequent questions that we get from people, and so we are certainly sensitive to these issues. We really are trying to work with the state with regard to childcare issues. We're also looking at whether there could be some additional options for daycare and for support from daycare within our community. And there's a lot of discussion going on with this. And you're right that it's not just a matter for research. It's a matter for everything across campus. And these discussions are underway. We realize it's crucial.
Thank you, Maria. That's certainly a question that we will need to address at a broader institute level in the days and weeks ahead. I'm going to ask us to wrap up now, noting that many of you have stayed beyond, have other appointments, as well as many in our of our audience. I would only note, and this is not something to respond to now, that there are still many questions coming in about accountability, about ensuring that people abide by the guidelines. And so that's just something for you to take into account. The planning seems strong. The thinking is obviously thorough, but the question of adherence to the guidelines is something that people are concerned about, and very reasonably so. So I'll leave you with that thought and ask Maria if you want to make any closing remarks before we wrap up.
Yeah, so first of all, you know, we all want to come back. We all want to start the research engine going, but as you can tell from Alfred's closing statement here, as well as all the input that we're getting, people really are concerned that when they come back, they can be safe. And people, we need to realize that, that when people are making their decisions of whether or not to come back to the lab, safety is one part of it, but also availability of daycare is another part of it. Having elderly or at-risk folks in their house is a part of it. And so when we think about the acknowledgement forms of when a person, if a person feels comfortable coming back, we need to be really sensitive of the fact that when somebody isn't able or isn't on the list to come back, that there's a very good reason for it. And we basically all need to work together. I think the committee has just done an extraordinary amount of work in order to give as much guidance as they can to try to plan a return that is staged and phased and safe. If we had a stampede coming back at the beginning, we would surely fail. And so we're all going to have to work together and realize that we all want the same thing and that everybody is well-meaning here. And that well-meaning part of it is to stay safe and restart research. So I'll just stop right there and look forward to having everybody's cooperation as we work together to get back to work.
Thank you, Maria, and thank you to all our panelists. Even those of you who didn't have an opportunity to contribute, thank you very much for joining us. And for all who are joined us today, we appreciate it. There's clearly many more questions that need to be worked through. This committee and this team are working very hard to work through them and are considering the possibility of a second gathering of this nature to get deeper into the questions. So we'll let you know more about that as things develop. But for today, thank you very much for joining us, and I hope everyone has a great and long weekend. Thank you.